Good day, everyone. I'm Alexander James Y. Pallet. So for today, I'm going to show you the proper procedure of the application of moist heat or the compress and sitz bath. So the purpose of this assessment is to give relief of muscle spasms, decreasing of joint stiffness. It stimulates circulation that promotes healing, reducing inflammation or edema, extensibility of collagen tissues, and provides relief and comfort. So for the assessment, we need to identify the patient using at least two identifiers. Refer to healthcare providers, order for type of moist kit application, location and duration of application. These are temperature and agency policies regarding the temperature. Perform hand hygiene and assess the skin around the area to be treated. Perform neurovascular assessment for sensitivity to temperature and pain. Refer the patient to medical record to identify contraindications to moist heat application. Inspect the wound for size, color, drainage, tenderness, and odor. Assess the patient's blood pressure and pulse. Assess the patient's mobility. Assess the patient's level of comfort. Assess the patient's and family members' understanding of application and related safety factors. So for the planning, we need to identify the expected outcomes. We need to assemble all the tools and equipments that we're going to use in this procedure. So first, we have sit stub here, a pitcher of water, a bath thermometer here, a bath towel, and a bath blanket. And we have also a Epsom salt. Okay, so for the implementation, we need to introduce ourselves to the patient. We need to verify the client's identity. Explain to the client what you're going to do, why is it necessary, and how the client can cooperate. So explain the steps of procedure and purpose to patient. Describe sensation, patient would feel, and precautions to prevent burning. So good day, ma'am. I'm Alexander James, your nurse for today. Can I know your name, ma'am?
I'm Annalisa Palat.
Okay, so how old are you, ma'am?
I'm 25 years old.
Okay, so for today, I'm going to perform and I'm going to apply a moist heat to you, ma'am. Is it okay with you?
Okay.
Okay, so after explaining the procedure to the patient, we need also to explain to them what they feel, what would they feel in this procedure. So, ma'am, this examination or this assessment have moderate pain, but you can bear with us. Okay, so can we proceed now, ma'am?
Yes.
So after explaining the procedure to our patient, we will now provide privacy. So as you can see, I already closed the window, I already closed the door, so it is safe now to do the examination to our patient. So position the patient in bed, keep affected body part in proper alignment, expose the body part to be covered, drape patient as needed. So as you can see, I already placed my patient in a comfortable position and I already placed the infected body part in proper alignment. Here, okay, so ma'am, can you please rest your hand? Okay. So now I'm gonna perform hand hygiene. And I will now apply a clean gloves. So after we perform hand hygiene and wearing our gloves, we will now place waterproof pads under the patient's appropriate infected body parts. So I'm gonna get the, here is our waterproof pad. So I'm gonna place it here. So apply moist sterile compress. We have here a heat solution, desired temperature properly here. We have heat solution here. And prepare aquathermia pad if needed, set temperature if needed. So remove any dressing present, inspected condition of food and surrounding the skin. Okay, so we need to inspect, we need to remove the dressing of the wound. So we will now inspect the color and the odor of the wound. Okay, so I will now remove. Okay, so after removing the dressing, we need to dispose the gloves with the dressing in a appropriate receptacle. So I'm gonna place it on a appropriate receptacle. Okay, so I'm gonna perform hand. So the wound, there are presence of redness and any inflammation. Okay, so now prepare our heat compress. So we need to pour the solution in the container. So I'm gonna pour it here. Okay, so I'm gonna pour it. So after pouring the heat solution, so we need to open a gauze. Since we don't have a gauze, we will use a improvised gauze here. So we have two. We have two gauze. We need to place in the heat solution. So okay, so add gauze to the container of solution to immerse gauze. Use proper aseptic technique. So as I stated a while ago, since we don't have any um, gauze, we will use an improvised gauze. Okay, so the gauze is in the container with the heat solution. So follow the instructions for warning using commercially prepared compress. So apply sterile or clean gloves as appropriate. So I'm gonna use clean gloves again. Okay, so after we apply our gloves, we need to pick up one layer of gauze. We need to exhaust out the excess solution to and we need to apply it to the wound. Okay, so I'm gonna get this here and we need to apply it to the wound. Okay, so after applying to the wound, lift the edge of the gauze to assess for redness. So we need to wait um a few minutes and we need to assess if there's any redness, any inflammation, or any reaction to the wound. Do you feel any pain, ma'am? Okay, so we need to lift the edge. Okay, so there are presence of light redness to the wound of our patient. So after lifting the edge of the gauze, we need to pack gauze snugly if patient tolerated compress. Cover all wound surface with the compress. So cover the moist compress with dry sterile dressing and bath towel. Pin or tie in place. Remove and dispose of gloves to perform hand hygiene. Okay, so apply aquathermia or heat pack or waterproof heating pad over the towel, keep in place for desired duration. So I have here a heat pack. So the duration of this is to 10 to 15 minutes. So we will wait until the time duration. Do you feel any pain, ma'am? Okay, so we will wait the time duration. Okay, ma'am. So change warm compress using sterile technique as ordered if pad or heat pack was not used. So as you can see, I have a heat pack here. So we need to wait for the duration of the time. So we need to apply clean gloves. Okay, so I'm gonna apply these gloves again here and here. So after applying a clean gloves, we need to remove the pad, the towel, and the compress. Reassess the wound, the condition of the skin, and replace a dry sterile dressing. Okay, so here, I'm gonna remove this, mom. So I'm gonna remove this bath towel. So I'm gonna remove this compress here. Okay, so upon observation, so the redness becomes there are no presence of any redness. So as you can see, the red is very light. So we will now place a dry sterile dressing. So after applying dry sterile dressing, so now help the patient to preferred comfortable position. So ma'am, can I help you to place in a comfortable position? Okay, so are you now more comfortable, ma'am? Okay, so I'm gonna remove this pad and I'm gonna place it here. Okay, so dispose of equipment and soiled compress, perform hand hygiene. So I'm gonna remove this clean gloves. Okay, so I'm gonna. So ma'am, that's all includes our assessment. So thank you for cooperating with us.
Well,
So now we're going to proceed on the procedure of sitz bath or warm soak to intact skin or wound. So first thing that we're going to do is to perform hand hygiene and apply gloves. So after performing hand hygiene and after we apply our clean gloves, we will now remove the existing dressing covering wound to our patient. Dispose the gloves after checking the or after removing the existing dressing to our patient. So, ma'am, can we expose your renal area so we can check if there's any abnormalities or any swelling. Okay, so don't worry, ma'am. I'm going to cover you. So after we remove any existing dressing covering wound to our patient, we will now dispose our gloves. And we will now perform hand hygiene. So after we remove any existing dressing covering wound to our patient, we will now dispose our gloves. And we will now perform hand hygiene. Inspect the condition of wound and skin. Pay attention to suture line. So upon inspection, the skin of my patient is no presence of any severe inflammation or any redness. The skin of my patient is intact and there are no presence of any exudates. So apply gloves again. We have here a clean gloves. So here, so after we wear our gloves, we will now clean the intact skin around open area when exudate was present. Dispose the gloves after cleaning the intact skin. Okay, so ma'am, I'm gonna clean the specific body part of your renal area. So we're gonna clean it using antiseptic swab. So upon cleaning, there are no presence of exudates or any abnormalities. So after we clean, we need to discard this antiseptic swab with together with the gloves. So I'm gonna perform hand hygiene. Fill the bath with warm solution. Check the temperature. Okay, so using this solution, we will now pour it in a clean container. After we pour the warm solution, assist the patient to bathroom. Immerse a body part in bath. 10 to 25 minutes or as ordered. Cover the patient with blanket or towel as needed. Okay, so since I don't have a real patient, so as you can see my patient, let's assume that this chair and this basin is the bathroom of my patient. So as you can see, my patient is the body part of my patient is already immersed in the bath. So we will wait until 10 to 25 minutes as ordered. So assess the heart rate, ensure that the patient was not lightheaded and that call light was within reach. So as you can see here, we will use a stethoscope to assess the heart rate of our patient. So, ma'am, I will assess your heart rate. Okay. So, the heart rate of my patient is between the normal level, which is 70, which is totally normal. Okay. So after 25 minutes, we will now remove the patient from soak and we will now dry the body throughout. Okay, so ma'am, I will help you to remove from the soak. So after we remove the patient from soak and dry the patient, we will now drain the solution from basin or tub clean. and placed in proper storage area. So I am already done cleaning the basin, and I'm done placing it on a proper storage. I will now dispose of soiled linen and gloves. Okay, so I'm gonna dispose these gloves and I'm gonna perform hand hygiene. Okay, so for our evaluation, inspect condition of body parts or wound for evidence of healing. Observe skin color, temperature, edema, and sensitive to touch. We need also to ask patient to describe level of comfort, ask about any sensation of burning following treatment. We need also to obtain vital signs compare with baseline. Ask the patient to demonstrate how to apply compress at home. Identify unexpected outcome. So for our recording and reporting, we need to record and report all the pertinent information of procedure. We need also to record the pre-procedure and post-procedure of the vital signs.